All right, let's dive into seizure disorders. Today, we're unpacking the crucial differences between epileptic and non-epileptic events. To put this in perspective, a staggering 50 million people worldwide are currently dealing with epilepsy. But get this, up to 30% of patients at epilepsy centers are actually misdiagnosed. Crazy, right? Many of these folks have non-epileptic seizures, or NES. They mimic epilepsy perfectly but need totally different treatments. So, what's a true epileptic seizure? Well, it's essentially a sudden, massive electrical storm in the brain. Normally, your brain relies on a delicate balance. GABA acts as the brakes and glutamate is the gas pedal. And this brilliantly illustrates what goes wrong. The brakes fail or the gas sticks, causing massive electrical bursting. This storm follows strict phases, It moves from early warning signs straight into post-seizure confusion. The main event itself looks wildly different, depending entirely on which part of the brain is taking the hit. Now, what's really interesting here is the big question. What if it's not actually epilepsy at all? Enter PNES. It's a functional disorder linked to stress or trauma and entirely lacks that electrical misfiring. So the crucial point is comparing them visually. Epileptic seizures are shorter, eyes open. NES episodes last way longer. Because they look similar, video EEG monitoring is the absolute gold standard. It captures brainwaves, so we know for sure. Misdiagnosis is a massive tragedy. NES patients often endure years of unnecessary and potentially harmful anti-seizure meds. Their real treatments are completely opposite: specialized meds for epilepsy versus targeted trauma-focused psychotherapy for NES. Jumping back to true epilepsy, hospitals use a strict escalating medical protocol if a seizure just won't stop. This rapid escalation prevents permanent brain damage. But hey, what should you do if you're an everyday bystander? First, stay calm. Keep track of the time, softly cushion their head, and use the side recovery position. And let's crush some dangerous myths right now. Never restrain them and absolutely never put anything in their mouth. It is literally critical to call for emergency help if the seizure lasts longer than 5 minutes. The facts in this explainer can honestly save lives. If it happened right now, would you know how to react?